Hello, my name is Sawayo Tabitha Griffith, an advocate of the High Court working on health-related rights. Welcome to this first module where we will be discussing health and devolution. By the end of this forum, we hope that you will have a better understanding of the legislative framework and the distinction between the national government and the county government frameworks. We also hope that by the end of this forum, you will be able to identify as a doctor the available opportunities for you to participate and to conduct advocacy on national and county forums. Historically, between 1963 and 2010, Kenya had no specific law that regulated health. The Constitution of Kenya at that point of 1969, in fact, made no specific provision on health as a right. Now, what this meant was that whereas the government still had an obligation to its citizens to provide health services, the citizens of Kenya could not go to court to enforce the same. The Kenya Health Policy Framework between 1963 and 1988 was largely one that was anchored on a socialist approach. This meant that citizens could easily access healthcare without paying for it. Notably though, in 1989, this all changed with the introduction of the Structural Adjustment Program by the World Bank, which meant that the government now had to impose user fees and citizens therefore had now to pay for their own healthcare services. In the absence of a law, the Ministry of Health in the early years of the 90s was largely guided by the Kenya Health Policy. The 1994 Health Policy was implemented through the National Health Sector Strategic Plan. This strategic plan would subsequently be amended every 5 years and revised in order to take care of the existing resources and to also feature the new constraints in the health sector. During these years, whereas there existed no singular law to regulate health matters, there existed several piecemeal documents that were used in various sectors in health to regulate a variety of issues. For instance, we had the Public Health Act, we had the Nurses Act, we had the Clinical Officers Act, the Pharmacies and Poisons Board Act, as well as the HIV Prevention and Control Act. All these laws, sadly, existed as piecemeal documents that could not regulate the health sector holistically and comprehensively. In 2010, Kenya promulgated a new constitution. Now, this constitution is deemed to be the supreme law of the land. Article 2 of the Constitution speaks about the supremacy of the Constitution and, in fact, indicates that where there is an inconsistency, including in customary law, then that law is void to the extent of the inconsistency. The Constitution of Kenya 2010 is deemed to be one of the most progressive documents in the world. Indeed, one of the things that has been recognized as a gain in the 2010 Constitution is the recognition of health as an enforceable right. Article 43 of the Constitution of Kenya recognizes a variety of socio-economic rights. This includes the right to housing, the right to health, the right to water, the right to education, and the right to sanitation. All these rights are deemed to be obligations that the state must enforce for its citizens. As regards health, the particular section is Article 43(1)(a), which clearly stipulates that every person has a right to the highest attainable standard of health, including reproductive health. Article 43(2) of the same Constitution recognizes that every person has a right to emergency medical treatment and no person should be denied that right. Other sections in the Constitution that can be interpreted to support the right to health include Article 27(4) of the Constitution that speaks about freedom from discrimination. We also have Article 53(1) of the Constitution that speaks about the best interest of the child and the right of children to have a healthy life. Article 46(1)(c) of the Constitution of Kenya additionally also guarantees consumers the protection of their health, safety, and economic interests. All these rights, as read together within the Constitution, subsequently safeguard the right to health. What does this mean for the Kenyan citizen? A reading of all these sections of the Constitution means that a Kenyan citizen can be able to go to court and litigate on the right to health. Indeed, several cases have been litigated in the courts of law between 2010 and 2018, progressively allowing for Kenyan citizens to enjoy the highest attainable standard of health. Besides the Constitution, we have several laws that have been enacted between 2010 and 2018 that support the right to health. One of the key and most prominent laws is the Health Act, which was enacted in May 2017 after a long and protracted battle between the Senate and the National Assembly. What are the key features of the Health Act 2017? One of the most prominent things that the Health Act does is that it actually encompasses a definition of what health is. It embraces the World Health Organization definition, which is within the 1946 preamble of its constitution. Indeed, the Health Act defines health as a complete state of physical, mental, and social well-being, and not merely the absence of disease. The Health Act also has several important features for a doctor to be able to know. One of these things is under Section 5 of the Health Act, which speaks towards access to free maternity services as well as free vaccination for children under the age of 5 years. Additionally, Section 6 of the Health Act gives the rights and responsibilities over reproductive health. Section 7 of the Health Act speaks towards emergency medical treatment and penalizes any medical institution that refuses to offer 3 key things under emergency medical treatment. These include pre-hospital care, stabilization of patients, and quick and easy referral of patients when a facility does not have the capacity to treat the patient. Additionally, it is also worth noting as doctors that Section 12 of the Health Act indicates rights and duties of a healthcare provider. There are 5 key duties that Section 12 enunciates. One of these rights is the right not to be discriminated when offering medical services. Number 2, the right to a safe working environment as a doctor. Thirdly, the right to refuse to treat a user who is verbally or physically abusive. And number 4, the right of any doctor to apply for any salaried position, whether it is in public or in private sector. All these sections are extremely important for you as a doctor. We therefore encourage you to take a few minutes of your time and familiarize yourself with the provisions of the Health Act and also any other laws that are relevant to you as a doctor.